Good evening, everyone. We'll just give everybody a few minutes. Happy Sunday. Hey, good evening, everyone. Happy Sunday. So just want to welcome you to our session. We'll be focusing a lot on next generation Nclex, especially the question types. And again, what we learn is not only for today, not just for the exams, not just for NCLEX, but every day, right? Because once you become a registered nurse, which also stands RN stands for Rockstar Nurse, right? That's what you guys are all going to be. You want to make sure that you're having the knowledge and the skills to make sure that you can take care of every patient that's assigned to you, right? So welcome again to Everyday Nursing with me, Dr. M. So we're going to go through and really focus tonight on the next generation NCLEX item types and the scoring. And then I'll introduce you to the type of questions. The best way, of course, to make sure that you're going to be successful is to make sure that you're familiar with the question types, because how you prepare is how you're going to perform, right? So you want to make sure that you're studying to make sure that you're able to answer these types of questions. So again, make sure at the end you should be able to understand the different types of questions, or at least have a better understanding of the types of questions, and of course how next generation scores your overall questions, right? And how they're applied to the different item types. Now, the biggest thing too is to remember that next generation NCLEX is very different from what we saw before in the past. The length of the exam really is from 70 to 135 scored items. 15 of those items are randomly placed in, so you don't know which ones they are, and a lot of them don't count. Those 15 that you might get don't count. So again, minimum is 70 to 135. You will get 15 additional questions that don't count, but you're not sure which ones they are. So they're just using it, they're randomly mixed in, okay, to see for future testing types of questions, right? So you just want to make sure that you're still answering every question to the best of your ability. Now, minimum number of questions with those 15 is going to be 85. Maximum number of questions is going to be 150. You have a total of 5 hours, okay, to answer those questions. When you are studying, stamina is going to be very, very important to you. If you already put in your head that the NCLEX is a 150 question test, it takes away a lot of the fear and a lot of the anxiety. Okay. If you see the test keeps getting longer, again, preparing to take a 5 hour, 150 question test is how you all should be studying. Okay. Again, if it shuts off at you at 85, that's great. Okay. But again, you want to make sure that you're preparing for the long haul. 5 hours, 150 questions. Now, out of those 150 questions or 85 questions, depending on the minimum, okay, if you get 85 questions, 18 of those questions will be case study style questions, meaning minimum. If you get 85 questions, you will get at least 3 case studies. Each case study is made up of 6 questions. Okay, so that's what we'll be doing tonight. We'll be doing a sample case study. So I want to make sure everybody's clear on that. Okay, so again, 85%, 85 questions, 21% will just be case study style questions. So that's just kind of the ratio that we're seeing, okay, for the board. So just make sure you have that firm understanding. Now, these are the websites you want to make sure you're familiar with. The first one, of course, being the NCSBN, the National Council of State Boards of Nursing. Remember, all 50 states, right? There's an NCLEX. The NCSBN writes it for all 50 states. So they're the one that governs everything. They have your test plan. They have sample questions. They have all the updates, right? So again, part of this is to make sure that you guys are going to have access to these recordings. So I will be posting them on the YouTube channel, Everyday Nursing, so that way everybody can have access to them. Again, to make sure everyone's comfortable, okay? So make sure you really flag the NCSBN and this channel because I'm going to make sure I post everything there too, okay? Now, just to make sure everybody has a firm understanding, NCLEX is made up of 8 client needs categories, okay? In order for you to get a license, you have to make sure that you're above the passing standard in all 8, okay? If you have any areas of weakness, okay, it's going to show in one of the categories. So it's pretty much broken down into 4 categories with a couple subcategories. So the first category is safe and effective care and environment. It's made up of management of care, coordinated care. That's pretty much your leadership class. That's your priority, your delegation, your case management, your advanced directives, your legal responsibilities, okay? Your supervision, organ donation. Safety and infection control, again, really focuses on your airborne droplet contact precautions. It also focuses a lot on your universal type of precautions as well. Disaster planning, your triage, okay? Your standard precautions, restraints. Health promotion and maintenance is a subcategory of its own, just like I tell you guys too. Health promotion and maintenance is your OB section. It looks at growth and development from inside the uterus and on. So again, your vaccinations, again, what's happening antepartum, intrapartum, postpartum, all of those specific things, health screening, lifestyle choices. Your psychosocial integrity, again, many language of its own. That is what we call psych. Okay, that's psychosocial integrity. So of course you need to be well versed and making sure that you can promote clients being able to adapt, to cope, to problem solve, grief, loss. Again, you're going to see your typical psych disorders, bipolar, schizophrenia, okay? A lot of behavioral interventions. In your psychosocial integrity, you will also see this section includes a lot about abuse, neglect, elder abuse, child abuse, everything of that nature. So that's what's in that psychosocial integrity and crisis prevention. In addition to that, you have physiological integrity, which is made up of the rest of your 4 categories, okay? Basic care and comfort is pretty much what you learn from fundamentals, foundations. So that includes a lot of your activities of daily living, okay? Your different types of mobility, elimination, enema type stuff, positioning, personal hygiene, rest, sleep. Your farm section, right? One of your favorites, of course, includes all of those things that we talk about. Venous access devices, medication, chemo, and your farm section also includes your blood products. Okay, so again, all of those things are included in the farm and parental therapies and TPM. Your risk and reduction potential really focuses a lot on if you're able to minimize clients' risk, okay, to really make sure that they're going to be safe. So they look a lot of this section on different procedures, alterations in body systems. So this is more about procedures, tests, keeping them safe after a cardiac cath, a biopsy. If they have a scope, do you know to check for gag reflex? That's where that section comes in. And of course, last but not least, your main category is physiological adaptation. This really pretty much encompasses a lot of your critical thinking, your infectious disease, your fluid and electrolytes. This is heavy on the med search. Okay, so again, these are just a little overview of the 8 client needs categories. So in order for you to get a license, you need to be above the passing standard in all 8. So I did break some of that down earlier about knowledge and comprehension questions, and then application and analysis questions. Only application and analysis questions will give you a license in each of these categories. So again, having the knowledge is not going to be enough. Remember, it's going to be content and test taking strategies that are going to make you successful to pass boards. So part of your boards, the main things that we focus on exams and of course boards, is going to be comprised of these particular things. Again, the nursing processes, of course, your ADPI, your caring to see if you're going to be a caring nurse, communication, documentation, how you're going to communicate. Do you know when to document? Do you know about teaching, educating your patient, teach back, and of course, cultural and spiritual sensitivity. All of these things were covered and will be covered in test taking strategies 1 and 2. Okay, so I just want to make sure that you guys are aware of that. Now, when you take boards, especially for the first time, everybody starts off at the passing level, at the passing standard. Okay, so you're going to see that blue line is your passing standard. Okay, anything below that blue line is knowledge and comprehension questions. Anything above the blue line is application analysis questions. Okay, so again, you're going to see that the questions technically get easier below the passing standard because, again, they're just knowledge and comprehension questions. They get harder above the passing standard because, again, they really look on your ability to use the knowledge to make sure that you're able to take care of patients. So you're going to see usually when you get a right answer, it's going to make you go up if you were below. Okay, and you want to stay above that passing standard because it's going to ask you questions in all of those 8 client needs categories. But when you start getting questions wrong, as you can see here with the little incorrect responses, the little red dots, it drops you down. Okay, the whole goal of Nclex for you to get a license is to stay above this blue line, is to stay above the passing standard. Now, this is also how the test gets longer. For every wrong question, your test is going to get longer because it's trying to see where are you in that particular category. Okay, so that just gives you a little background on really how NCLEX really works. Now, there's different types of item types with next generation NCLEX. It, of course, has changed from just the basic multiple choice and of course, select all that applies, okay? So we're gonna go through the different question types, the bow tie, the highlight, the drop down tables and all of those different things, just to make sure that you guys are familiar with that different question types. Now, the basic scoring is the classic approach. You get a point for a correct response, no points for an incorrect response. Multiple point items are the sum of all the correct responses, okay? So this is what they use when they ask you to choose a specific number of responses. Now, everybody's familiar with just the multiple choice questions, right? If you get it right, you get a point. If you miss something, you don't get a point. So this is how NCLEX pretty much works. So you can see here on the example, which of the following actions should the nurse take if they were to give you a case scenario? You pick the right answer, you get a point. If you don't pick the right answer, you don't get the point. That's just a classic way they do just basic multiple choice questions. Same things that you guys should be used to as far as, of course, your nursing exams. Now, when we look at the matrix multiple choice, the matrix multiple choice is pretty much going to adapt that concept of a multiple choice type questions like a A, B, C, D, 1, 2, 3, 4, but it's going to look at it for each particular row. Okay, so you would treat each row as an independent multiple choice type question. Okay, so again, if they gave you pulse and you were supposed to pick pulse and you did, proved or not improved, based on what they gave you, they would give you a point. If you didn't pick anything and you left it blank, or you didn't pick, or you picked the wrong answer, you would get an incorrect answer, which would be red. Okay. If you pick nausea, pain, urine output in the correct way, you would get a point. Now, the way they do these number of rows is to look at each row. So there's a total of 5 rows. So the way they do it is pretty much like a plus minus type system. So if you get 4 correct, but you miss 1, okay, that automatically just gives you 4 points. So if you were to get 3 correct and 2 wrong, okay, that's how they grade this particular section. So it's a plus and minus. So of course, the more you get wrong, the more it takes away. Okay, so you want to be very mindful of that. If you got 3 right and 2 wrong, your net point would just be those 3 points. Okay, so you're not going to get credit for everything else. So anything that you pick wrong is no points. The ones that you get right, you get a point. Okay, so that's how they do the matrix multiple choice. That's how they grade it. Okay. Now, when we look at the multiple response selections, so these are the things that if they tell you to pick a specific number, so the example of this question you would see would be select the 3 complications the client would be at risk for developing based on whatever scenario they gave you. Okay, so you're instructed a certain number. Now, once you pick that number, okay, that's really what's going to help you get the points. So you can select less than the stated number of keys, but you must at least select one of them. So like for this one, the way they're going to grade you, if they tell you to pick 3, okay, and you pick peritonitis, septic shock, okay, and dysrhythmias wasn't a part of it, again, you just get credit for your correct responses. You don't get anything for the incorrect response. It doesn't take anything away. Okay, so that's how the multiple selection work when it asks you to pick a specific number. Okay, that's how they grade it. Now, when we look at this one, say you only pick 1 correct response, okay, and you didn't pick anything else, or you picked dysrhythmias, it would just give you credit for that 1 point. So this is how they're scoring your exam, okay? You get it right, you get a point. You don't pick anything, it doesn't take anything away, but again, it's looking at a point system for these particular types. So again, if you were to get all 3 correct, it would give you 3 points. Now, the drop down closed types of questions. So usually you complete a passage by selecting from 1 or more drop down options, right, from which to complete the paragraph. So this particular one, there can be anywhere from 3 to 5 options, anywhere from 3 to 5 drop down types. Okay, so it gives you a little scenario. The nurse has reviewed nursing notes from 1230, 1245, 1400, 1450, and the diagnostic test results from 1230 and 1445. Complete the following sentences by choosing from the list of options. So again, the nurse should insert, it will give you types to pick from, okay? It would be a priority for the nurse to request a prescription for, again, it would give you medication to pick. The nurse should prepare the client for surgery within a certain amount of time. So these are how these drop-down questions work. They're going to give you a scenario. Based on that scenario, you're going to pick the proper responses that go with that particular scenario. Again, a 1 drop-down question can include multiple parts, anywhere from 3 to 5. Okay, so that's part of what you're going to see. So the way they do the drop-down closed grading. So say you got the first one right, you got the second one wrong, and you got the third one correct. You only get points for the correct responses. Again, the wrong response is just a 0. Okay, so you're always trying to get the maximum number of points. You're not penalized for these questions for getting them wrong. You just don't get any credit. Okay, so you want to make sure that you're aware of how that is graded. Okay, now the drag and drop closey types questions are going to be pretty much, again, the same style, but what you have to do now is drag the words to that appropriate box. Okay, so again, the right number, the right correct response, you get a point. If you got two wrong choices, no point, no point. So for this question, it would just give you 1 point. Okay, so again, hopefully this is starting to make sense about the grading on how they grade these questions thus far. Okay, so you're not getting a plus or a minus yet. It's just what are you getting correct? Okay, so again, you want to try to get the maximum number of points for each particular question. So the drop-down table, okay, is another format of that particular example type that I gave you that you can also get. Again, it's just a plus or a minus, but it's only based on if you're getting it correct. So again, if you get the correct response, you get a point. You get it incorrect, no points are given to you, okay? So what they can do, they can pretty much give you a table. So this is just an example. For each body system, click to to specify the potential nursing interventions that would be appropriate for the care of that particular client. They would give you a scenario. Each body system may support more than one potential nursing intervention. So again, for neuro, they can put assessed level of consciousness, cranial nerves. Again, it might be more than one right choice as long as you pick one of the right choices. Respiratory, they could put lung sounds, they can put tactile fremitus, they can put egophony as long as you pick one of the right ones. Cardiac, same thing. The heart rate, do S3, do you hear anything extra? So you want to make sure that you're picking the one based on the system. Okay, as long as you pick something related to what's correct, it can be more than one correct answer. You'll get awarded a point for it. If you pick something wrong, again, no points. Now, the bow tie items are going to be very, very important because the bow tie items address all 6 steps of pretty much, again, that critical care, critical thinking nursing model. Okay. The response falls into 3 unique categories. Okay. So all targets must be utilized for the candidate to move forward. So if you can see here, the nurse is reviewing the client's assessment data to prepare the client's plan of care. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. So you're going to pick a diagnosis, okay? So you're going to drag, you see in the middle where it says potential conditions. So based on what it gave you, you have to know what condition the patient has, okay? So based on that, you have to pick 2 actions related to that condition. And then, of course, 2 things that you would monitor for that condition in order to move forward. So you're going to move the condition there to the blue. The actions to take, you're just going to pick 2 from this side. And then parameters to monitor, you're going to pick 2 from that side. And remember, it forms a bow tie, okay? So again, it has to match. So here is the example, okay? So for this particular question, right, the condition it was describing, of course, would be ischemic stroke. So if the answer was ischemic stroke, what actions would I take for patients that had an ischemic stroke? I would administer oxygen to 2 liters per minute via nasal cannula, and I would make sure, of course, that they had a peripheral venous access device. Okay. Now, I would monitor a patient for ischemic stroke for what? Neurological status. Okay. But you can see here, if I picked temperature for some reason, okay, instead of ECG, okay, which is the correct response, I'm only going to get points for what I picked that was correct. Okay. So this was a total of 5 points that I could have gotten, but because I picked one wrong answer, I didn't get any points for it. I'm not penalized. I just don't get any points. I only get points for what I answer correctly. Okay. So this is a classic bow tie questions. It always is going to relate to that primary condition. So if I pick something else, right, Bell's palsy, and I pick 2 other things, remember your condition has to match your actions and what you're monitoring. If you completely pick the wrong condition, of course, and you pick the wrong things to monitor, the wrong things, of course, actions to take, you won't be successful on these types of questions. So that's why when you study, it's very, very important to know, again, the signs and symptoms, the patho, the etiology, the assessment findings that you're going to find, the implementation, and what you monitor. What do you check, okay, for those particular conditions? Now, that was pretty much the 0+ rule, okay, the 0-1 rule. Okay, now we're going to look at the plus and minus type grading, okay? So this one, okay, can be used for different types of questions, like the select all that apply, and of course, different ones. The key for this one is that you will be awarded a point for selecting the correct information, but you will lose a point for selecting incorrect information. Okay, so this is how the different types of items will be graded as well. Okay, so that multiple select all that apply. So if you get a basic select all that apply type question, which of the following conditions could the client be experiencing based on the case scenario that they gave you? So say you pick, based on the signs and symptoms that they gave you, you think it might be acute pancreatitis. It might be a myocardial infarction, the heart attack. The patient might be suffering from a AAA, abdominal aortic aneurysm. They would give you 3 points. But because you picked ammonia, okay, you get minus a point. So the multiple select all that applies. You have to be very, very mindful. Okay, you get credit for what is right, but every wrong choice is going to take a point away. Okay, so say for some reason I also picked septicemia. Okay, I got 3 right, but I got 2 wrong. I would only be given 1 point for this type of question. So again, this is another way that you can see a select all that apply based on what you get. So if you have the same type of question, but you only pick 2 that were correct, you're just going to get credit for your 2. Okay, so you would get 2 points. So again, with the select all that applies, you want to try to make sure that you only pick what you know is correct. Now, earlier part of the test taking strategies that I said is your select all that applies. You're just going to pick it and view, select all that applies. The key is this, whether it's true or false. True or false, the client could be experiencing septicemia. True or false, the client could be experiencing pneumonia. True or false, the client could be experiencing appendicitis. True or false, the patient can be experiencing acute pancreatitis. True or false, it can be an MI. True or false, it can be a AAA. Start using your test taking strategies to make your life easier, especially you want to get as much points for these select all that apply questions. So again, in this type of situation, okay, if you were to pick 2 correct answers, but you pick 3 incorrect answers, okay, there's no negative points on the boards, thank goodness, right? But again, can it cancel out? Yes, okay? So this situation would not give you a negative point situation. It would just cancel each other out and give you a 0, okay? Again, boards for any question, there's no negative points. It's just total points, correct, incorrect, minimum number of points will be a 0 for these particular type of questions. Now, the highlight text is very, very important. As you guys are studying, as you guys are practicing, have your highlighters with you, okay, for the case scenarios, for the different types of questions you guys are doing. Get very, very comfortable, okay, with these highlight text questions. Now, the biggest thing, right, is that it's going to tell you click to highlight the findings below that would indicate the client is not progressing as expected. So they expect me to highlight based on the note, based on this situation that answers their question, which issues are showing that the client is not progressing. Okay, so there can be a maximum of 10 different options for these highlight questions. Okay, so the good thing about it is you can click, so you can highlight, and if you don't, and you can unhighlight at the same time. So you can select and unselect, right? So the client is post-op day 3 after splenectomy and is able to ambulate in the corridor 3 to 4 times daily within the minimal assistance. The client has clear breast sounds with a left chest tube in place attached to a closed system, a closed drainage system, a chest tube, right? Because remember, the only thing that can re-expand the lungs is a chest tube. So we see tiling of the water chamber is noted, right? So you have to know if that's something expected or unexpected with deep inspiration. The client is refusing to use their incentive spirometer, stating it's causing left-sided chest pain. The client is using the PCA, okay, device maximally every hour and continues to have intermittent nausea with vomiting. They have adequate urine output. Abdominal surgical incision site is dry, clean, dry, and intact with no erythema, edema, or drainage noted to the site. Okay, so it's asking you to interpret this note. So if we were to go here, okay, based on what it asks you to do, you would have to highlight the things that would indicate the client is not progressing. So again, the ambulation in the corridor, you would get a point. The client has a clear breast sounds with the left chest tube. Again, is that something that shows they're not progressing? Not necessarily. Okay, so again, that's something that you would miss that would count as a minus for you. Okay, titling. Okay, refusing to use the incentive spirometer, continues to have intermittent nausea and vomiting. Adequate urine output. Those are things that I expect to see. Those are normal findings. Okay, I'm only picking the things that would worry me. Okay, are there a few more things here that you could possibly highlight? Probably. Okay, how often are they using that PCA? It says maximally every hour. That could be a potential issue, right? Again, the dressing site is clean, dry, and intact. That's exactly what I want to see. So these types of questions are looking at your ability to spot things that are normal and expected versus unexpected, abnormal findings. Okay. And the highlight questions are a plus and minus system. You want to get as much right, but for every wrong answer, they're going to subtract a point. So you can see here, there was a total of 4 correct responses, but 2 incorrect. So the total points awarded for this particular question would just be 2 points. Okay. So again, it's better just to pick the ones that you know for sure are correct, okay, for the highlight types of questions. Now, the highlight table is, again, the same concept, but you're highlighting it in a table. So this particular question example can say the nurse is in the clinic and is caring for a client. Click to highlight below the findings that require immediate follow-up. Okay, so again, these types of questions are very, very important because again, look at that bold word. Part of our test taking strategy was to pay attention to words. When I see words like immediate, priority, okay, I'm automatically thinking airway, breathing, circulation, life and death. So these are things that I need to pay attention to. Remember, health assessment, your history and physical, right? Your assessment is the first part of the nursing process. You have to know what's normal and what's not, okay? So if you look here in this particular section, it gives you system by system. That's exactly what you're going to be doing as a nurse, system by system. So if I look at neuro, it says pupils equal and reactive to light and accommodation. There's my perla. I like that. Okay. Anterior and posterior fontanelles are sunken. Don't like that. Patient moves all extremities, but a little weak. Okay. But they're moving all their extremities. So I'm paying attention to things that require what? Immediate. Okay. So again, anterior and posterior fontanelles are sunken in. You need to be able to recognize that as a sign of what? Potential dehydration. Now moving on to my respiratory, my lungs, right? Crackles noted in the bilateral bases upon auscultation. Definitely an abnormal finding. They're retaining fluids. Mild grunting and head bopping, a little bit of tachypnea. Again, depending on what's happening with the patient. You can highlight up to 10 things, okay? I'm looking at cardio. Okay, pulses +2 in all extremities. Is that normal? Okay, Am I looking at capillary refill? 3 seconds. Hands and feet slightly cool to touch. Mediastinal chest tube in place. Serosanguinous drainage noted. Is that normal? Okay. Hypoactive bowel sounds. Pardon me. Hypoactive bowel sounds. Abdomen soft and round. This is very important. Your health assessment, normal and abnormal findings. Again, there can be a maximum of up to 10 options. You want to highlight as much of the findings, right, that require immediate follow-up. So for this particular example, right, that anterior and posterior sunken fontanelle, very abnormal finding, I need to follow up. Crackles, I need to follow up. Pulses +2 in all extremities, that's a normal finding, okay? I'm not gonna pick something that's normal, okay? So again, you only get points, right, for what is correct. But because I picked something that was incorrect, I only get 1 point for this question. Again, the highlights are always plus minus. Okay, that's how they grade. So again, please add it to your laundry list of things. You need to go back and make sure that you're very aware of your health assessment, normal findings, system by system. So the matrix multiple response really focuses on a response. Each response column could have multiple correct answers, okay? Each column must have at least one response option selected. So for each one, you have to pick one, okay, for it to make you move on to the next question. So you can select as many options as applies for each column. So this one you're asked, the nurse is reviewing the client's assessment data. For each assessment finding below, click to specify if the finding is consistent with the disease process of bowel obstruction, appendicitis, or a ruptured spleen. Okay? Each finding may support more than one disease process. This is testing your ability to know what signs and symptoms. Okay? These are very common things that we see in GI, right? My GI system. So again, I have to look at this and say, okay, for a bowel obstruction, would I expect to see appetite changes? Would I assess, to assess their pain levels? Okay. Would I assess bowel pattern? Will I expect to see GI symptoms, nausea, vomiting, diarrhea? Again, appendicitis. Am I assessing those things as well? Okay. Ruptured spleen. Am I assessing those things as well? So remember, for each one, again, you're picking one and you can use them multiple times. Okay. So when we look at these particular scores, again, it's a plus minus system. Okay. So they're going to plus and minus the ones that you get right. They're going to subtract the ones that you get wrong. Okay. So for this particular matrix multiple response, okay, based on what they asked me to do, for bowel obstruction, I would assess pain level. Okay. For appendicitis, I would assess appetite. For ruptured spleen, again, pain level. You see how pain level can be applicable to what? Bowel obstruction, ruptured spleen, but also, of course, it could be applicable to appendicitis. Okay, so you're looking at all the ones that you should have picked, okay, for this particular one. So you want to make sure that you're very familiar with your signs and symptoms. What are you assessing in these particular patients? Now, this is what I mean about these, understanding the questions to help you study better, okay? Especially GI. It's one of those systems where a lot of things can overlap with each other, okay? So you want to get a clear understanding. Again, we focus on those things with GI: appetite, pain level, bowel pattern, loose stools, constipation, diarrhea, nausea, vomiting, okay? So again, this is going to help you really figure out how to study. So for this one, based on this, if you got 3 correct, but you got 3 incorrect, you wouldn't get any points. So remember, this is always based on the plus minus system. So if this particular question, again, remember, for the plus minus systems, there's no negative points. The lowest number of points you can get for these types of questions is 0, meaning you got more wrong than you did right. It would cancel each other out. okay? And it'll keep you at a 0 for these types of questions. So again, -1, 1, 0. But say you got 1 right and 2 wrong, again, you're not going to get a -1. It would just, of course, leave you at a 0. So that's how they grade these types of questions. The whole point of boards is to get as much questions correct in the particular category that keep you above the passing standard. So again, this just shows you the different scoring and the points based on what you get right and what you get wrong. So these particular answers here, you can see plus, 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 minus, 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 again, based on how you answer these particular questions. Now, multiple response grouping. Okay, you'll be given a table with several different groupings, anywhere from 2 to 5. You must select at least one option for each group. Okay, and you have to select as many options as apply for each grouping. So for this question type, the example is going to give you is for each body system below, click to specify the potential nursing interventions that would be appropriate for the care of the client. Each body system may support more than one potential intervention. So for neuro, am I doing neuro checks? Am I sending them to CT? Am I giving them morphine? Okay. Am I doing an EEG? Respiratory, are they going for a chest x-ray? Giving them O2, ABGs, and center spirometer. It's going to be based on the scenario that they give you, okay, for that particular patient. That is what's going to guide your answer choices, okay? And you can see a lot of this is based on what? Assessment. Do I know what tests? Do I know what to assess? Do I know what to implement, okay, for each particular system, okay? So for cardio, aspirin, echocardiogram, do they need to be on a telemonitor? Do I need to have defibrillation at the bedside? Can they go into a lethal arrhythmia? So again, this is a plus or minus type of system. So of course, the more you get correct, you get a point. Any negative wrong answers, you're going to subtract the point for this particular type of question. So of course, for this one, 1, 2, 3, 4, 5, of course, we're correct, okay? And then of course, there's 2 incorrect responses. So the total amount of points will be based on what you get correct and what you don't get correct, okay? Depending on each of the categories, okay? So of course, for this one, you get a 2 up here. For this one, you get a no points. For this one, you get a 1 point, okay? So each particular group has its own point system. So I got 2 because I got the neuro section right. I didn't get anything for respiratory because I got 1 right, but I got 1 wrong. So it canceled each other out, okay? For cardio, I got 2 right, but I got 1 wrong. So my net point is only 1 point. So this is how they grade the multiple response grouping. Again, my net points for this particular question is 3, okay? Because each system, of course, has its own number of points. So again, this is pretty much how it breaks down for each particular one. Now, there's different types of dyad questions and triad examples, okay? So these particular question looks at different things. So we're going to go through them very briefly. So the drop down one is to complete the following sentence by choosing from a list of options. So the client is based on the scenario, you have to pick. The client is at highest risk for developing, and you pick vital signs, neurological assessment, respiratory, cardiovascular, is it hypoxia, okay, stroke, dysrhythmias, pulmonary embolism. What would tell me that? So the keyword you would look for is evidence, okay? So again, if it's hypoxia, what assessment would I do? Respiratory. If it's stroke, what assessment would I do? Neuro. If it's dysrhythmias, what would I click? Cardiovascular. If it's a pulmonary embolism, I'm looking at the vital signs, right? So again, you're looking at the stuff that match, okay? So these are how you do the drop-down rationale type questions. What matches, okay? It's something as evidenced by. So again, those nursing care plans that you thought would never mean anything, right? As evidenced by. I picked this because this is what I see. This is what I assess. This is what I know I'm checking. Okay, so that's what we see for the drop down type of questions. Okay, now they can have different ones here, the different style here. You can see that if it's going to ask you to drag and drop. So this is a drag and drop type of question. So again, drag one condition and one client finding to fill in each blank in the following sentence. So based on the scenario, the client is at risk for developing infection due to purulent drainage from incision site. Do you see how that matches? Okay, so again, based on your scenario, you're gonna pick what you think the condition might be based on the findings. They have to match. Okay, they have to match. So the client could be at risk for developing wound dehiscence because I'm looking at what are they approximated? Okay, is the wound approximated, right? Is it closing properly? So this is another way you can use some of that knowledge that you have. Again, you get full credit when you pick things that match, okay? For these particular questions, they have to match, okay? There's no credit given if you pick one and then the other part is wrong, okay? All of it needs to be right for you to get the point. So that's how they do these particular types of questions. Okay, the dyads. So this is an example of a dyad that you can get on boards. Both parts have to be right. Okay, the triad, okay, dyad was 2, triad is 3. Okay, the client could be at risk for developing as evidenced by this and this. So I'm finding a finding and I have 2 things to support my finding. Okay, so that's what I can see with that particular scenario. So you get partial credit, okay, if I pick 2 parts that were correct, but one was wrong, okay, I'm only getting 1 point for that question. If I pick 2, but one was wrong, again, I only get 1 point. The dyads and the triads the dyads are just, you get it all right to get a point. The triad kind of gives you a little bit more leeway, okay, for the points, because you want to try to get all 3 right, okay, because that could be a maximum of 3 points. But for every one you miss, it's going to take a point away from you. Okay. So again, if you don't get any of them right, you don't pick anything, no points. But again, try to pick something. If they're all wrong, no points. Okay. So again, it'll be no points based on, again, if you pick anything that's correct. Okay. So this, of course, just kind of explains some of the questions. So I'll be doing more case studies and question types too. So we're going to get into the case study just because of the sake of time. Okay. So this is a case study that you can see on boards. Okay. So remember the case studies, minimum that you can, number of questions is 85. So you can be given 3 case studies. Each case study has 3 questions. So the nurse cares for a 23-year-old male in the emergency department who is experiencing acute onset of shortness of breath. The nurse assesses the client on admission. Which findings require immediate follow-up? Select all that apply. And remember, this is a plus minus. So for everyone you get right, you get a point. But for everyone that you get wrong, you miss a point. Okay. So very quickly, can you guys look at what would you follow up on? Would it be shortness of breath, chest tightness, respiratory rate, a dry cough, audible and expiratory wheezing, tripod positioning, speaks only a few words between breaths, blood pressure, tenderness of the chest wall? What here would require immediate follow-up for this patient? So this is a select all that apply. So for everyone I get right, I get a point. But for everyone I get wrong, they're going to subtract a point. So you want to make sure you pick things that are what? Correct. Okay. Now, part of the case scenario, the case scenarios all continue with each other. So it's going to tell you that part of your nursing notes, okay, at 11 a.m., client reports shortness of breath and chest tightness that has progressively worsened for the past 2 to 3 days. He has a history of seasonal allergies. He's a non-smoker and lives at home with his mother, who is a current smoker. Denies fever, vomiting, describes feeling fatigue, has a dry cough at night. Okay. And at 11:15, 15 minutes later, you hear audible and expiratory wheezing, auscultated throughout the lung fields bilaterally, increased respiratory rate noted, Capillary refill is less than 3 seconds. Skin is warm to touch. Chest wall is symmetrical with no deformities. Client sits upright and leans forward, resting his hands on his knees in tripod positions and speaks only a few words between breaths. Tenderness when you palpate his chest wall. Trachea is midline with no deviation. Labs are drawn. Chest x-ray ordered. Okay? So again, I see a lot of you picked some key things here, right? This is what you should have picked. Shortness of breath, chest tightness, respiratory rate increasing, audible and expiratory wheezing, okay? I'm also paying attention to what? Only speaking a few short what? Breaths. Those are all very, very important to me, okay? And another one here I could highlight is actually the tripod positioning. The tripod positioning is a sign of what? Tripod. Respiratory distress. Yes, that's what you're paying attention to. Remember, a lot of this is painting a picture for you. Your case scenarios are going to be very, very heavy on your ability to see what's normal and what's not. Okay. So the second part of this question, okay, gives you the particular patient, right? Now it's going to ask you, the nurse caring for this particular patient. So for each potential finding, click to specify if the finding is a risk factor or not a risk factor for asthma. Okay, so this is question number 2 to the case scenario. Is family history a risk factor or not a risk factor? Is allergies a risk factor or not a risk factor? Beta blockers risk factor, not risk factors. Edema, risk factor, not risk factor. So again, you have to click each one that you think is a risk factor, not a risk factors. And remember, this is going to help you guys study. When you study disease process, remember your non-modifiable, your modifiable what? Risk factors. You need to know them. Okay. So again, we look at our risk factors for asthma: smoking, overweight, diabetes. So when you pick your answer choices, okay, you need to make sure you know what is a risk factor for asthma. Okay, family history, allergies, okay, beta blockers, right? You have to know the difference between beta 1 and beta 2. Because if you give the wrong beta blocker to an asthma patient, you're not getting a license. Okay, you have to know which one are cardio selective and which ones are non-cardio selective. Okay, so again, the wrong beta blocker will close the patient's airway if you try to give them a rescue medication, right? Viral infection, smoking, being overweight are all risk factors. The only two here that aren't risk factors are edema and diabetes. Okay, so for every one that you get right, you get a point. So the next part of the case study is going to give you, again, this is the vital signs for the patient. Okay, they're going to give you vital signs. They're also going to give you labs. Okay, so they're going to give you references for your labs. Okay, they're going to tell you that the diagnostic test came back. Remember, the doctor ordered a chest x-ray. The chest x-ray shows hyperinflation of lungs with flattened bases at the diaphragm. Okay, so I'm looking at this to see what's normal, what's abnormal. And they give me my range, right? But I need to know what the numbers mean. Okay, is it high? Is it low? What am I thinking? Okay, so it tells you that you got your labs and you got your chest x-ray. So the next question would be complete the sentence from the list of drop-down options. The nurse should recognize that the client is most likely experiencing what? Is it pneumonia, pulmonary edema, acute asthma onset, a pneumothorax, or sleep apnea? How do I know? Because I got to back it up. It's most evidenced by, is it the vital signs that I saw, the patient having shortness of breath, expiratory wheezing, orthopnea, or fatigue? Those are my choices. So what do you guys think the client is experiencing? Anyone, just take a guess. So this is a very, very important part, okay? So when you guys pick these types of questions, right? The patient is experiencing an acute asthma attack. How do I know? As most evidenced by expiratory wheezing, okay? So again, asthma, classic finding of asthma. Your gold standard sign and symptom is expiratory wheezing. That high-pitched whistling sound is a sign of what? Bronchoconstriction. Okay, that's the first sign of an asthma attack. That's how you answer those drop down options. Okay, so based on that, again, same information there for that particular patient. You have to know what to do. This is very important. This is a plus or minus. Remember, your select all that apply is you get points for what you get right, but you get points taken away for what you get wrong. So which intervention should the nurse anticipate will be included in the plan of care? Am I giving oxygen if the O2 sat falls below 93? Am I giving albuterol treatments every 4 hours as needed? Am I placing the client in a supine position? Am I giving low dose aspirin? Am I giving labetalol by mouth 2 times a day? Am I giving ibuprofen every 6 hours for pain? Am I raising the head of the bed? Am I giving solumedrol? Am I giving fluids by mouth? What would you pick for an acute asthma attack? What am I doing? O2, albuterol, yes. What about positioning? Raise the head of the bed. Yep, sit them up. So again, this is the important part, right? I'm administering my O2, giving albuterol, raising the head of the bed, giving solumedrol. Don't forget your corticosteroids, right? If they had ipratropium bromide, I would pick it, right? Remember, your short-acting beta-2 is your albuterol, your cholinergic agonist, right? Like your ipratropium bromide. Pick it if it gave it to you. Oxygen, corticosteroids, okay? Labetalol is a type of what beta blocker, okay? It blocks albuterol, okay? It's not one of those beta blockers I can give to an asthma patient. I definitely don't want to pick that. Okay, so this is an example of how you use your nursing judgment and your knowledge. So it gives you your lab results. It gives you the time. Okay, at 11:30, nebulizer treatments and solumedrol is given. Patient denies shortness of breath or difficulty breathing. Lung sounds or breath sounds are improving. Client can speak in full sentences and tolerates activity doing well. No reports of fatigue. Okay, you have some orders there. Monitor pulse ox, albuterol, ipratropium, place peripheral IV, instruct the client on using their peak flow meter. Okay, so this is important. This is another question all related to the same case scenario. You review the physician's orders and consider the need for teaching. For each action, click to specify if the nurse should implement the action immediately, within the next hour, or before the end of the shift. You need to know what you're doing. Do I do it now? Do I have a little bit of time, or can it wait? So if I have to give education on the peak flow meter, when do I do that? Do I give the O2 now? Do I give the solumedrol in an hour or at the end? This is how they're testing what you know. So instruct the client. I can do that at the end of shift. That's teaching. Do I want to place them on O2? Yes, right away. Do I want to give the solumedrol? Yes, right away. Do I want to give my albuterol and petroleum? I need them to do what? Have stable, open airways. I'm giving my drugs. Okay. Teaching, I can do within the next hour. Okay. That pursed lip breathing. Medications at the end of shift. pulse ox right away. So this is just an example of how you answer these types of questions, okay? So based on these things, right, if the client is doing better, right, I need to know. So determine the client's status. Are they improving, deteriorating, or remaining unchanged? Okay? What should you do now? Prepare for discharge to go home, resume to breathing treatment, continue to monitor the client's breathing. Based on the assessment, it told you that what you did, the client was doing better, right? So I would put that the patient was improving and I would prepare to send them home. Their shortness of breath got better because of what I did. Their O2 levels increased. Okay. So it's looking, did you solve the problem? Do you know when you have a safe discharge? Do you know when a patient is getting worse? Okay. So again, based on this, okay, you're going to see a classic bow tie. We're going to end with this one, okay? The nurse assesses the client after implementing the treatment plan. Complete the diagram by dragging the choices, right? What condition the client is most likely experiencing. You're going to pick 2 nursing actions based on what they have and 2 things that you monitor. So we said that the patient has what? Status asthmaticus, right? What actions would I take? Would I obtain a sputum culture, suction their airway, give epi, high flow O2, or diuretic? And based on what I do, what am I going to monitor? Temperature, pulse ox, respirations, troponin, or urine. So everything has to match my center, my status asthmaticus. Okay, the actions I take for asthma have to match the what I monitor for an asthma patient. Okay, so based on this, I want to make sure, of course, I can give epinephrine, right, to open up those airways, and I can administer high flow oxygen, right? Remember, status asthmaticus is a severe life threatening condition. Okay, part of the treatment, it didn't give you albuterol, you need to give epi. That's your emergency drug. Status asthmaticus is something you need to be very familiar with. These are patients that have severe asthma. They can die if you don't know what to do. What am I going to monitor? Pulse ox and respirations. Okay. So that was an example of a case study. That's all 6 sections of one case study. You're going to have 3 of those. How do you get better with these questions? Practice makes perfect. This is how you study. You prepare and you practice to perform on your boards, okay? So part of this was from, of course, the 2022 Nclex conference, and I got most of it from the NCSBN. So you want to make sure, of course, that you're focusing, that you're doing well, okay? Please fill out the survey at the end. I'm going to post everything on the YouTube channel. Like it, subscribe to it. This is all for you guys, for you to be successful, okay? So please make sure we're going to continue with test taking strategies part 2, okay? In a couple weeks. In about a couple weeks, I'll post it so that way you guys can have it. Okay. So thank you so much. Thank you so much for your time. We went a little over, but we'll be continuing to do case studies now that I explained them. Okay, we'll be doing one every couple weeks just to make sure everybody has a firm grasp. We'll be doing NGN questions. Okay, no problem. Okay, and you guys will have this available as soon as I'm able to post it. Okay, you guys have a good night. Thank you for coming. Thank you for taking the sacrifice and pouring into your success, okay? Have a good night. I'll see you guys during the week. I'm going to post it there in the chat. It's over in the beginning as well, okay?